Hi there, this video is a review on how to answer priority type questions on your nursing exams. As a reminder, the handout for this information is always available to you on my Canvas Success shell under modules. So to begin this, we're going to realize that the most important part, which is the first step of test-taking strategies, is very simple, and it's also the nursing process. We want to read the question very carefully to assess what the question is about. We can't intervene safely without an assessment, so read the question slowly and assess what is this question really asking me. For priority type questions, it's important to recognize these key words. You will see all of these words. Most of these are the most common words that are used for priority questions, but they're going to indicate that more than one answer is going to be correct. You just need to find what is the best answer for this particular situation. This priority strategy process includes 3 steps. Those are Maslow, the nursing process, and safety. Let's go ahead and start with Maslow. Maslow, as I'm sure you can remember, has his hierarchy of needs. Those hierarchy of needs include physiological needs as the priority and the base of the triangle. Those are needs that are necessary for survival. You can't have anything above that unless those base needs are met. Those base needs includes things like oxygen, nutrition, temperature, a place to live, rest, and sex. Moving up the triangle is safety. Safety is right above those physiological needs. Safety needs in nursing can either be physiological, like there's something physically threatening to a client. They can also be psychological, like a patient voicing concerns or their ability to rely on help. But safety generally means things like the patient has their call light, their bed is lowered, their room is set up so they're not going to slip and fall on a rug, IV and oxygen tubing is placed well and not tangled around things, there's no needles lying around. Those sorts of situations indicate safety. And then above safety, finally, we have all of the psychological needs. Psychological needs are things like listening actively to your patient, supporting them, having active eye contact, and healthy relationships. So let's see how Maslow is used for prioritization. There are 3 steps in the Maslow prioritization process, and these are the 3 steps. Number 1, are the answer choices physiological or psychological? Do the answer choices make sense? This is where you need to know your content. And can you apply the ABCs? And just as a reminder, ABCs, A is a patent airway, that's clear. B is breathing and gas exchange. And C is the blood is actually circulating. So let's have a look at a question. The nurse has developed a plan of care for a client diagnosed with anorexia nervosa. Which client problem should the nurse select as the priority in the plan of care? So we know this is a priority question, and we're going to start with Maslow. Remember, the 3 steps is the answer choices physio or psych, do they make sense, and can I apply the ABCs? So let's start with step 1, malnutrition. Is that physiological or psychological? Malnutrition is physiological. Inability to cope is psychological. Concern about body appearance is psychological. Lack of knowledge about nutrition is also psychological. So we have 3 psych and 1 physio. Does my physio make sense? Absolutely. Malnutrition is definitely a concern with a patient with anorexia. My answer is number 1. The nurse is assessing the client's condition after cardioversion for atrial fibrillation. Which observation would be of highest priority? Starting again with the first step of Maslow, are my answer choices physio or psych? Blood pressure is physio. Status of airways, physio. Oxygen flow rate, doesn't really fit either. Level of consciousness is physio. So I have 3 physios. I can't eliminate from there. I need to move on. Does it make sense? And you need to know what kind of things we would look out for cardioversion after atrial fibrillation in order to say, does that make sense? But let's go ahead and say those 3 answer choices left over do indeed make sense. I'm not teaching content here. I'm just teaching how to use this tool. So let's just say yes, they make sense. And now let's apply the ABCs. Airway, breathing, and circulation. Blood pressure, that is a C. Status of the airway is an A. Level of consciousness is neither. So because I have an A and a C, I'm going to choose A, airway, which is answer choice number 2. Sometimes Maslow cannot help us select the correct answer, and if that happens, you need to move on to the next step. So if you can't eliminate answers or it just doesn't fit in, that's where you go ahead and move to the next step. And the next step in this 3-step process is the nursing process. That's ADPI, where we assess, gather information, diagnose, identify the problems, plan, where we develop goals, implement, those are the actions you're going to do as your nurse, and evaluate, where we measure the outcomes. So prioritizing with the nursing process, we're going to really focus on just these 2 steps, assessment, which is gathering data from your patient. This is going to take priority over other steps because we need to assess before you implement, and that's very important. And the other step is implementation. That's the care you're going to provide. So assessment is getting information from your patient. Anything you do that's going to get information from your patient is an assessment. So don't get confused because you are implementing, you are physically drawing labs, but that's an assessment because you're drawing labs to get information from your patient. So if what you're doing is to get some information from your patient, that is an assessment versus an implementation. That is just the care that you're providing. And let's see how we use this. So with this step, you have to say, are all of my answer choices assessments or interventions? Because if you have 4 answer choices and all 4 are assessments, then yes, you're going to assess. If you have 4 that are all interventions, then yes, you're going to do an intervention. But if you have, for example, 2 assessment choices and 2 intervention choices, I'm going to point out that it's very likely that one of those assessments and one of those interventions are going to be very good and your correct answer. But the question is now going to change. Do I need to assess or am I ready to act? And you need to go back to the question and say, do I have enough assessment or do I need to look for more? So here's an example of that. A nurse is teaching a client with coronary artery disease about dietary measures that should be followed. During the session, the client expresses frustration in learning the dietary regimen. The nurse should take which initial action? So we're going to skip Maslow just because we're focusing on the nursing process step right now. And that is assess before we intervene. So let's go ahead and look at our answer choices. Continue with teaching. That is an intervention. We're not getting any information. Identify the cause of the frustration is an assessment. Notify the primary health care provider is an intervention. And tell the client that the diet needs to be followed is also an intervention. So we have 1 assessment and we have 3 interventions. So go ahead and look back at the question and say, is there any assessment? We're trying to teach our patient, they're frustrated and we can't continue teaching. So yes, we need to find out why they're frustrated. There could be lots of reasons and they're not identified in the STEM. Maybe that patient doesn't speak English and they don't understand anything we're saying. So regardless of the reasoning, we need to go back in and do an assessment. So in this case, the answer is number 2, assess. Next question with this step. The nurse is caring for a client after cardiac catheterization. The client suddenly reports feeling wetness in the groin at the insertion site. The nurse checks the site, notes that the client is actively bleeding and should take which action, which best action. So let's look at the answer choices and say, are these assessments or implementations? Contact the primary healthcare provider is an implementation. We're not getting any information from our patient with that step. Check the client's peripheral pulse in the affected extremity. That is an assessment. Don a sterile glove and place pressure on the site with sterile gauze is an intervention. Don a clean glove and place pressure on the site with the gloved hand is also an intervention. Okay, so we have 1 assessment and we have 3 interventions. Let's look back at the STEM. So the client has wetness in their groin, they had a cardiac cath, they're actively bleeding. What do we do? Well, we don't need more assessment because I know that a problem we can have after cardiac cath is bleeding, and this patient is bleeding. We need to stop that bleed. So I'm not going to assess. I'm going to eliminate number 2, and I'm going to look at 1, 3, and 4, and look at my best assessment or my best intervention here. Contacting the doctor. I have a patient actively bleeding. I have a higher priority than contacting the doctor. So keep in mind, yes, there's going to be more than 1 correct answer here, but I need the best answer that's going to do the best outcome for my patient. So what do I need to do do first, I look at number 3 and number 4. And there's actually another key here. When you see answer choices that are opposite each other and you see don a sterile glove and don a clean glove, not that that's always going to be the correct answer, but just put a flag in your head and think, those are opposite each other. There's a very good chance one of those answers are correct. And which one is correct and best for this patient? The sterile glove with sterile gauze is going to be best because this is a cardiac cath. This was a line straight up into the heart. So we would optimally choose sterile. And then another thing students I see in my office will say is there's no chance that a pack of sterile gloves in my size is at the bedside. So they don't choose that answer because they know that patient's room doesn't typically include a sterile glove. So if the answer choice is provided, it is an optional resource for you. So don't be afraid to choose the answer that's a beautiful answer because you think that in the real world we don't have a sterile glove in my size at the bedside. They are offering it to you, so it is an option. So the answer choice here is number 3. Okay, this is our last question for the nursing process for prioritization. A client contacts his home care nurse and reports nausea and abdominal pain. He has type 1 diabetes. The nurse should advise the client to do which of the following. So again, following the ADPI, we're going to look for assessments versus implementation. Hold your regular dose of insulin. That is an implementation. We're not getting any information from the client with that step. Check your blood glucose every 3 to 4 hours while sick. That's an assessment. Increase your consumption of foods containing simple sugars is an implementation. And increase your activity level is also an implementation. So we have 3 implementations. We have 1 assessment. Let's go back to the STEM. Do I have an assessment? Let's see, the patient has nausea, abdominal pain, and also diabetes. I don't know anything that's going on with this patient at all, do I? Because lots of reasons for nausea and abdominal pain, and they have diabetes. So no, I don't have any assessment there. Does my assessment make sense? Check the blood glucose every 3 to 4 hours while sick. And because I have that content in my brain about diabetes, I know that my metabolic needs change when you're sick. So I might need to check my blood glucose more frequently while I'm sick. So that's a good assessment. My answer choice here is number 2. So the final step of this 3-step process for prioritization is safety. Safety includes meeting the basic needs of your patients. How do we do that? Well, for safety questions, all of your answer choices are interventions. They're stuff that we're going to do to help them. You have to be able to know what those interventions mean and what would result in the least harm, or what would give us the most information, or what is one thing I can do for this patient that would help the patient the most if I can only do one thing. And that particular one is my favorite. Do one thing and leave. If there's only one thing that I can do for this patient, what would it do? What would it be that I could do for them before I leave the room? Let's go ahead and take a look at how that's going to look. So here we have a question about safety. You enter the patient's room and find him deep asleep. The respiratory rate is 7 and the pulse ox is 89. What is your next best action? Priority question focused on safety. So let's take a look at these answer choices. Call a code, seek the assistance from another RN on the ward, wake and stimulate your patient, and begin oxygen 8 liters per minute by a nasal cannula. As you can see, all 4 of these choices are interventions. Okay, and then we need to base it on knowledge. You need to say, is it reasonable to call a code? Is it reasonable to seek assistance from another RN? Is it reasonable to wake and stimulate? Is it reasonable to begin oxygen 8 liters per minute? And when I see the oxygen, I think, 8 liters per minute, that is more than I really can give through a nasal cannula. That would be terrible. So I'm going to go ahead and eliminate that one just based on my knowledge. And then I'm going to think of that final step that I really like. Do the least harm, or what is the one thing that I can do that will help this patient the most? If I call a code and leave the room, that's not going to do anything, is it? If I seek the assistance from another RN on the ward, that's not really going to help my patient either immediately, is it? However, if I wake and stimulate my patient, that may wake them up. I might be able to get them to cough and turn around a little bit, breathe a little bit deeper. That is going to help my patient the most in this situation. So that is my correct answer, number 3. Wake and stimulate your patient. Here is another sample question regarding safety. A nurse is caring for a client who has dementia. The client is agitated and having difficulty staying in his chair. Which of the following actions should the nurse take first? So we have a priority question and we're going to say focused on the safety step. So apply a vest restraint on the client, place the client in bed with 2 side rails raised, place a seat alarm in the client's chair, and administer lorazepam to the client. You will see that all 4 of these answer choices are interventions. Okay, let's go ahead and say that based on my knowledge, these are all good answers too. They would all be reasonable things to do with a client with dementia, just to keep going. Now I'm going to look at that last step. What would cause, what would cause the least harm? Or if I could only do one thing, what would that one thing to do that I could do that would help the patient the most? Well, applying a vest restraint to the client, that causes some harm because I'm restraining them, and we don't restrain patients in the hospital unless it's fully necessary. Then let's look at number 2, place the client in bed with 2 side rails raised. Again, that's another restraint. There's not a whole lot of difference between 1 and 2, and when you see answers that are that similar, don't get rid of one of them because they're kind of the same. Place a seat alarm in the client's chair. That's not restraining the client, that's just letting me know if they get out of the chair. That's a good choice. Administer lorazepam is also, that's a chemical restraint. So I have 1, 2, and 4 are all some sort of restraint, and 3, causing the least harm to the patient. I'm going to put that seat alarm in their chair so that if they get up for any reason, one of us can run in and help them out. That is my correct answer. And one more question for an example for prioritizing with safety. A nurse is completing the initial admission assessment and history for a client. Which of the following is the priority action for the nurse to take? And we have teach the client about his diagnosis, provide a schedule of visiting hours to the client's family, document the client's allergies in the electronic medical record, and develop a plan of care for the client. And again, you can see that all of these are interventions, and all of them have to have some kind of knowledge to know, is that something that I would do? Is that something I would be concerned with? And let's just go ahead and say yes and apply the final step again. What would be the least harmful for my patient? Or if I only did one thing, what would be the best thing that I can do for this patient? And let's go ahead and look. Teach the client about his diagnosis. Well, that's kind of important for them to understand. Let's keep it. Provide a schedule of visiting hours to the client's family. Okay, I don't know if that's really important, but we'll keep it. Document the client's allergies in the electronic medical record. Like, oh, okay, allergies are important because that's potential harm to the patient if we give them, the wrong medication or such. So I'm going to definitely like that answer. Develop a plan of care for the client. We also know is important. But what is the least harm? Documenting the client's allergies is the least potential harm. So here, my correct answer is number 3. So now we're going to go ahead and try all of the steps, the whole 3-step process of prioritization. Let's look at our first practice question. A nurse accidentally sticks her hand with a syringe after administering an IM injection to a client. Which of the following actions should the nurse take first? So here we start with Maslow. Remember, Maslow is a 3-step process. Physio, psych, does it make sense, and can I apply the ABCs? So let's go ahead and start there. Physio and psych, report the incident to the charge nurse, wash the area of the puncture thoroughly with soap and water, complete an incident report, and go to employee health services. Do you see that none of those really kind of fit for physio or psych? We can't use that step. So then we go ahead and say, does it make sense? And let's just say that all of those do make sense because they kind of do all make sense, don't they? And A, B, and C, there really is no A, B, and C here either. So this is an example where Maslow is not going to help us. So we go to the next step. We go to ADPI, the nursing process. Are these answer choices assessments or implementations? And I'm going to look at those answer choices, and they're really not going to fit. Do you see that? Assessment and implementation, not so much. So now I'm really hoping that safety is going to work. So remember, safety, all of the answer choices are implementations, and these actually are. And I have to be based on knowledge, knowing that reporting the incident to the charge nurse is something that I would do, and washing the area of the puncture thoroughly is something that I would do. And these are, let's say all 4 of those are good things that we would do after getting a needle stick. So the last step of this whole process, what would cause the least harm, or if I could only do one thing, what is the one thing that would help this patient the most? And if I look at making an incident report, which we have to do, that's not really going to help my person. Wash the area of the puncture thoroughly with soap and water. Sure, that's a good thing that we can do. Complete an incident report, very similar to number 1. And go to employee health services, is important too, but we do have one thing that will help the patient the most in this particular situation is wash the area of the puncture thoroughly with soap and water. So even though the other answer choices are important to do, the best answer for the best patient here is number 2. Wash the area of the puncture thoroughly with soap and water. Here is another example. A 19-year-old comes to the emergency department with acute asthma. His respiratory rate is 44, and he's in acute respiratory distress. What is the nurse's priority action? So again, we're going to go ahead and start with Maslow, physio-psych. Take a full medical history, give a bronchodilator by nebulizer, apply a cardiac monitor to the patient, and provide emotional support. So it's kind of a little fuzzy here, but full medical history, bronchodilator, apply cardiac monitor, emotional support is clearly psych. So I'm just going to get rid of number 4 because the other 3 aren't clearly physio, but who knows? Do they make sense? Sure, it makes sense to know medical history on your patient. Sure, it makes sense for someone with asthma to get a bronchodilator. And maybe it does, maybe it doesn't. This is where your content has to, work, applying a cardiac monitor for this patient. But I'm going to keep going. I'm going to go ahead to my A, B, and C. And I'm going to see if I can apply any of those. Taking a full medical history, definitely not. A bronchodilator by nebulizer, well, that is airway, because if we have a respiratory rate of 44 in acute distress and asthma, I do need to open up that airway. So here, my answer choice is number 2, airway. We're going to need to open that up and get oxygen in there with that nebulizer. Moving on, here's another example. A client receives a wrong medication. The nurse who made the medication error should take which of the following actions first? So again, we have priority. Let's start with Maslow. Physio-psych. Call the client's provider, assess the client, notify the nurse manager, and complete an incident report. They don't really fit in. Do they make sense? Yeah, they kind of do make sense. They make sense, so let's keep them all. Are there any A, B's, and C's? I don't really see any of those either. So we're going to move on to our ADPI, our nursing process. Are they assessments or interventions? Call the provider is an intervention. Assess the client is an assessment. Notify the manager is an intervention. Complete an incident report is an intervention. Okay, so I have 1 assessment and I have 3 interventions. So let me go ahead and look back. Do I have any assessment? Client gets the wrong med. The nurse made an error. What do you do first? Gosh, there is no assessment. So the answer choice here is assess the client. And I will tell you that I have many students that come to my office and say, well, I know that you need to complete an incident report by law. You need to do this, you need to do that. And of course, the other 3 answer choices are certainly things that we would need to do. But what is the priority here? The priority is the patient, assessing the client and making sure that they are okay. So that is our correct answer. Here we have another example. A client smoking in his bathroom has dropped a cigarette butt into a waste paper basket, which begins to smolder. Which of the following actions is the nurse's priority? Let's take a look at Maslow, physiological versus psych. Close the fire doors on the unit, activate the alarm, move the clients in the immediate vicinity, use a fire extinguisher to put out the fire. I can't really fit any physio and psych in there. And let's just say that they all make sense. And I don't really see any A, B's, and C's in there either. So I'm going to go ahead and move to the next step, the nursing process, assessments, interventions. close the fire doors, activate the alarm, move clients, use a fire extinguisher. I can't really apply that either. So this is not going to be where I can eliminate based on the nursing process. I'm going to go to safety. And again, these are all interventions, and I have to base those answer choices on knowledge. Would it be appropriate to close the fire doors on the unit for a fire? Yes. Would it be appropriate to activate the alarm? Yes. Would it be appropriate to move clients that are in the immediate vicinity? Yes, it would. Would it be appropriate to use a fire extinguisher? Yes, all 4 of those would be appropriate answer choices based on the knowledge that I know for the situation. Now I have to go to the final step. What would do the least harm to my patient, or if there's only one thing that I can do and then I leave, what is the one thing that I can do? And clearly, moving people out of that immediate vicinity is the one thing that I can do that will help the patient the most. So my answer choice here is number 3. And again, the other 3 answers are great choices, but one is clearly my priority. Next question. When planning care for a patient in the post-anesthesia care unit, the nurse should first assess the client's respiratory status, level of consciousness, level of pain, and ability to move extremities. Let's look at Maslow. Physio, psych. Respiratory status, physio. Level of consciousness is physio. Level of pain, we actually consider that to be psych. Ability to move extremities is physio. So I can't really, I can eliminate number 3, but 1, 2, and 4 are all physio. Do they make sense? Yes, they actually do make sense for a patient that just had surgery. Let's keep them. Third step of Maslow, ABC. Well, respiratory status is an A, level of consciousness is neither, and ability to move is neither. So I do have an A, but be very careful. Don't always choose A for airway unless it makes sense. Does it make sense to monitor their respiratory status if they just returned from the post-anesthesia care unit? Yes, of course it does. They just had surgery. So that makes sense to choose that answer. So my priority here is number 1, respiratory status. Couple more questions here. Here we have a 40-year-old patient who is blind and deaf and has been admitted to the medical floor. What is the nurse's primary responsibility for this patient? So primary responsibility, this is wording as a priority question. Let's take a look at our answer choices. Make others aware of the patient's deficits, communicate with the nursing supervisor any patient safety concerns, continuously update the patient on the social environment, and provide a secure environment for the patient. So let's look at Maslow, physio, psych. Those answer choices don't really fit in for that situation. And let's say that they all make sense for this situation as well. A, B, and C, I don't really see those either. So let's move to the nursing process, step number 2, assessments, implementations. And we can see that these aren't really assessments and implementation situations. This is a safety question. So let's go to that last step. All 4 of those answer choices are interventions. And then the next part of that is knowledge. Make others aware of the patient's deficits. Well, that's a HIPAA violation. So I know that I'm going to eliminate number 1 right there. Communicate with the nursing supervisor concerns. Sure. Continuously update the patient on the social environment. Okay. Provide a secure environment for the patient. So 2, 3, and 4 kind of make some sense. So I'm going to keep all 3, and I'm going to go to the final step of that safety. What is going to cause the least harm, or what is the one thing that I can do for this patient and then leave the room? If I can only do one thing, providing a secure environment for the patient so that they're safe, being blind and deaf, is the best thing that I can do for this patient and then leave the room. So here, my answer choice is number 4. So this is our final practice question. Here we go. A client with a history of bipolar disorder is admitted to the psychiatric hospital. She was found by the police attempting to climb into the wing of an airplane at the airport. Her husband reports that she has not eaten or slept in 2 days, and he suspects she has stopped taking her lithium. On admission, the nurse should place the highest priority on which of the following client needs. So again, we have a priority question. Let's go ahead and look at Maslow. Physio, psych, teaching the client about the importance of taking lithium as prescribed. Providing the client with a safe environment with few distractions. Arranging for food and rest for the client. That one actually seems like physio. And setting limits on their behavior. So I'm going to go back and read because it looks like I can apply physio-psych, teaching the client about the importance of taking lithium. It's not really psych, but it's not really physio either. Providing the client with a safe environment, that's a safety need for sure. Arranging food and rest is clearly a physio need. Setting limits is not really either at all. So here my answer choice is C, arranging for food and rest for the client, because that's a physiological need for my client. And if I had to arrange my priority here, I would choose safety. Number 2 is my second answer, but thankfully we don't need to do that. We just need to choose the best answer for our prioritization, which is arranging for food and rest for the client. Okay, so that concludes my tool for answering questions with my prioritization tool. And again, keep in mind that these are tricky, but the more you do these practice questions, the better you're going to get. I promise you, you start to see little red flags and ways that you can dig through your answer choices to find the best answer. So keep on practicing, keep on moving, and make sure you remediate on topics that you don't know whenever you have the possibility, because you never know when you're going to see them again. So thank you for watching my video. I hope you enjoyed it and found it helpful. Have a great day. Bye-bye.